Hello, everybody. Good evening to our very special participants. I am Dr. Eza, and I welcome you to our today's free webinar about guidance about planning a pregnancy. Dr. Yasmeen Haseeb is a renowned consultant, professor, and specialist in high risk pregnancy with over 30 years of experience in ops and gynecology. She has completed her specialization in London, UK, and is recognized for her exceptional care in addressing women's complex health issues. As the founder of RoyalDocline, she leads the Safe Motherhood initiative, offering expert medical guidance and empowering women to take control of their health. Key areas of expertise are high risk pregnancy management, gynecological conditions like fibroids, cancers, PCOS, and infertility, menopausal health, irregular or heavy periods, advanced contraception, and complex surgical procedures. Dr. Yasmeen is fully dedicated to providing personalized and high quality care for all of you. You can access her services and stay informed through online consultations for expert advice. You can join our WhatsApp group, Royal Docline Women for health tips and support. You can see link in the chat box. You can also follow us on Facebook, Instagram, and LinkedIn as Royal Docline for updates and community engagement. You can also watch free informative videos on common women's health issues and everyday concerns by Dr. Yasmeen herself. At the end of each session, you can post your questions in the WhatsApp group and you can receive answers directly from Dr. Yasmeen Haseeb. Take charge of your health with Royal Docline, your trusted partner in women's wellness. Over to you, Dr. Yasmeen. Now we are going to start with today's webinar.
Good evening, everyone. Thank you so much, Dr. Isa, for such a comprehensive introduction. And as Isa has introduced me to you, I welcome you all beautiful ladies and the girls to our channel today. And it was possible with the help of Dr. Isa, with all of my Royal Docline marketing team, to make this webinar possible, which I was planning since long time. But because of my lots of the clinical commitments, surgical commitments, teaching commitments, it was always delayed. However, I really thank you to everybody. Before we start on to the presentation today, I would just like to tell you that what uh, what was the idea that why I started to have the Safe Motherhood initiative. Actually, I worked for the last 30 years in different countries, UK, Saudi Arabia. Currently, I'm in Bahrain, Pakistan, and I have been to different forums and I'm speaking about the women health in the different countries as well, because I'm an international speaker and researcher. And I have seen that a lot of the women, they die during the pregnancy, during the labor, after the birth. And even many women, they are undiagnosed with the cancers of the genital tract, which is the uterus and the ovaries, and they die without the diagnosis. So this was always touching my heart, and I was always thinking, why not to give the information to the women? Many a time I saw that the women, they did not know that even they are pregnant, or sometimes they come to the hospitals in a very late state. Young women, like 18 years, 19 years, 25 years, uh, seeing them dying is really miserable situation with the high blood pressure, with the diabetes. So I decided to initiate a Safe Motherhood initiative because I think that having a safe motherhood is the right of every woman. So that the idea behind all this effort and the webinar and everything which I'm doing on my social handles is to save our mothers and to have a good woman health. So for today's lecture and the today's presentation, actually, we have divided it into two parts: that how to plan your pregnancy and what is a pre-pregnancy care. Actually, the pregnancy starts even before you conceive your pregnancy, which is called as a pre-pregnancy care. This is a concept in the Western countries, in the UK, in America, and the other countries. They are talking about the pre-pregnancy care, which our women, they are lagging behind. So we will start with it, and then we will see that how you can make yourself safe during your pregnancy journey. I also deal with the women genital tract situations, and you can find many informative videos regarding the women health, pregnancy, menopause, cancers of the cervix, cancers of the uterus on the Instagram channel, on the Facebook channel with the name of the RoyalDocline. And I think my team will also share the link with you. And now let's start with our presentation without any delay. So Isa, can you kindly please let me know, can you see my presentation?
Yes, yes, I can.
So I welcome you all to the pregnancy planning, our first part of this lecture. And this is a short about me. Yeah, regarding our goals, the goal of the Safe Motherhood Initiative under the flagship of the RoyalDocline is to promote the healthy pregnancy practices and timely interventions, ensuring the access to the high quality maternity care, reducing the maternal and the newborn mortality. And then our key focus areas will be educating the women and the families about the prenatal care, postnatal care to prevent any complications, and ensuring the skilled medical assistance during the childbirth. Because during my long years of the experience, I saw that the women are dying because of the three major killers all over the world. They are high blood pressure, pyrexia or the high grade temperature during the pregnancy or after the birth of the baby. And the third one is the increase in the amount of the bleeding just after the birth of the baby, which we call it as a postpartum hemorrhage or the PPH. And however, in the research and in the literature, it has been seen that the woman is young. She takes time to die. So we have to intervene in this golden time where we have to catch her and we have to save her life. So this is our key areas of the focus, that how you can recognize not only for you, but also in your colleagues, in your friends, in your families. If you see a woman who is suffering with any problem, where to seek help. Because I saw that sometimes there is a delay in the decision making. For example, the woman has got a delivery at home or somewhere far away, and then the family is waiting for the woman to be taken to the hospital, who is bleeding like anything after the delivery. Maybe she has some tears or laceration, or the uterus is not contracting properly after the birth, and they are just waiting for the decision to be taken either by the husband or by the head of the family where to take her. So this is first delay. Second delay is delay in the transport. Okay, they take a decision to take the woman to the hospital. However, when they come out to the roads, there is a delay in the transportation. They may not have any transportation, or there may be the traffic blockage or anything like that. So this is the second delay. And then there is a third delay, which is the 3D actually model. The third D is actually the delay in the treatment in the hospital. See, there's all the 3Ds which let the woman die earlier. So we have to focus on all these things in order to avoid the complications in the pregnancy, as well as in order to making the safe motherhood as an enjoyable event. So, because I believe that every mother deserves a safe and healthy journey through the motherhood, that's why I have started working on it after long term of the experience. Now I have decided that I have to play my role and I have to put my share in the women health. So, what is a Safe Motherhood Initiative? What is it? As I talked before, this aims to ensure that every woman receives the care she needs to be safe and healthy during the pregnancy, during the childbirth, and even after the birth of baby. Actually, this is the Safe Motherhood Initiative. So we will see that what is planning of the pregnancy, how you plan a pregnancy. It is actually involving even before you become pregnant. That is, you make your plan that you want to have a pregnancy. Okay, so planning a pregnancy involves a thoughtful preparation and the consideration. It is important to understand both the emotional and the physical readiness and the well-being of the woman, so that you can have a healthy pregnancy and a healthy baby at the end. How you assess your physical health. A preconceptional checkup, which we will see in a while, what is it, with the healthcare provider or your doctor, is very important. You have to discuss any underlying health condition which may affect the pregnancy. For example, the woman may have high blood pressure even before the onset of the pregnancy. She can be diabetic, she can have heart disease, she can have kidney disease, she can have liver disease, she can have anything. Or she has got an operation on her uterus, or she can have any other problem. She can have the breast cancer. So, in all these situations, you have to discuss everything with your doctor, what medications you are taking, what are your concerns. You have to ask everything. And then, very important, in nowadays we are having lots of the patients who are coming with overweight and obesity in this era of the time. So maintaining a healthy weight and the lifestyle is also very important, not only for your fertility, but for the healthy pregnancy outcome as well. How you understand your fertility? You should familiarize yourself with your menstrual cycle to aid in timing to get pregnancy. Charting the ovulation can help identify your fertile days. Age can impact the fertility, so it is important to consider the family planning timelines. That is, nowadays we have seen in our experience that people are more career oriented and they want to delay their pregnancies. But please remember, there is a time duration where you can have a good and healthy pregnancy outcome. And this is usually in between 20 to 30 years of the age group. Please don't delay your pregnancies in order just to have your career. Your family is also as important as your career, because as the age advances, the complications of the pregnancy also becomes increased in the way. So nutrition and the supplements, a balanced diet which is rich in the vitamins, minerals, they support the reproductive health. Folic acid supplementation are very important for preventing the neural tube defects, which are usually the brain defects or the spinal cord defects in the children, is very important. You have to start it even before you become pregnant or when you are planning a pregnancy. Stay hydrated and avoid any processed food because they can all impact your wellness as well as your weight and then the fertility. And nowadays, polycystic ovaries or the PCOS is very common because of our lifestyle and because of these processed foods. So, lifestyle modification, reducing the alcohol and eliminating the smoking can improve the fertility outcome. This part is specifically important for the Western women because it is much more common over there. So, we are advising them to reduce or stop alcohol and eliminate the smoking because they can improve the fertility outcome. Regular exercise can help manage the weight and reduce the stress level. Limiting the caffeine intake, which is a tea actually, it may also contribute to the better pregnancy health. So don't try to drink too much coffee if you are planning a pregnancy. Emotional well-being is also as important as your physical well-being because you have to have a mental satisfaction and emotional well-being because it plays a very important role not only in the conception but in your pregnancy outcome. Consider the counseling or the support group to discuss any anxiety or the fear. Practice the stress reduction techniques which can enhance the emotional readiness for your pregnancy. Then comes the financial planning. This is also very important. Understanding the cost which is associated with the pregnancy and the childbirth is very crucial. Consider creating a budget which can include the prenatal care and the baby expenses. Health insurance coverage for those people who are having the health insurance, they should also plan about the maternity care. It should be reviewed and get the information. Here comes the genetic consideration. There are the couples in which there are some genetic problems ongoing in their family. So they have to discuss it with their health practitioner in order to see that what are their options, and the screening for the genetic disorders may help in making the informed decisions. Informed decisions mean you have the information so that you can make a decision in the light of that informed counseling or the informed information which you get from your doctor. Then comes a partner involvement or the husband involvement. This is a very important part where your husband or the partner in the planning process foster the support and the communication. Both the partners, they should consider their health and lifestyle choices, discuss the parenting styles and expectations to align a future goal. Because bringing a baby is something which is very important. Just to bring the baby is nothing. You have to bring up this baby in a proper way to make him a useful individual of this society. So you have to work for it together with your husband or with your partner. So the conclusion in this planning a pregnancy is it is a multifaceted process which requires a preparation, Regular consultation with your healthcare provider can guide your journey. Being proactive enhances the chances of a healthy and a happy pregnancy. So here you can see lots of the thank you letters behind me, and the people become very happy when the outcome of the pregnancy is good, and they just want to say you thank you in the different ways. Then you feel pride in that moment, and you feel satisfied in that moment. Now we come across to the pre-pregnancy care. This is also a very important and a crucial part where I would say all the participants should be much, uh, very much attentive in this part of the care, in this part of the presentation, because I believe, with my experience, that the pregnancy care starts even before the pregnancy starts, and this is the pre-pregnancy care, which is the most neglected area in the third world countries. So the idea of Safe Motherhood initiative also encompasses the pre-pregnancy care. It embraces it. So I will say that pre-pregnancy care is a pivotal role, and it has got a very important part in the pregnancy later on. It encompasses the health and the wellness practices which the woman should engage in before the conception. It aims to optimize the maternal health to improve the pregnancy outcome for both the mother and the baby. This care includes the medical care, nutritional care, and the lifestyle consideration. So these are the three most important things where you have to have the proper counseling and the proper planning. Until that time, when your doctor says you are not fit at the moment to get pregnant, you have to have the contraception, because we don't want you to suffer during the pregnancy and don't want the coming baby to suffer. For example, if the woman is hypertensive, let me give you an example. If the woman is hypertensive, she becomes pregnant without any planning, without any pre pregnancy care. She doesn't know that she is hypertensive. So, what can happen to her and what can happen to her baby? This is what we see in our daily life practices. She herself can have more rise in the blood pressure because there are the changes in your body to adapt itself to the upcoming event of the pregnancy. The blood volume increases, heart rate increases, kidney changes happen, intestinal tract changes happen. So all of these put the burden on the body of the woman, as a result of which the blood pressure will shoot up. She can have headache, she can have heart problems, she can have kidney damage, kidney failure. She can end up in the fits and the conversions. And then the baby may not grow because the baby is taking only the food from the blood of the mummy. The baby cannot eat or drink. He is or she is dependent upon the oxygen and the glucose which he or she is bringing or taking from the woman's placenta. So if the placenta is not working, how the baby will get the food? So at the result of which the baby cannot grow. Baby may be small, baby may die, and the end up will be an outcome which is affecting the woman, the family, the partner, and even the doctors. When we see all of these complications, the doctors are also understands what to do in this situation. Then she has to get admitted into the hospital, having a lot of the medications, undergoing the operations, and nothing is coming out. Baby may die, baby is preterm, maybe like 25 weeks, 26 weeks, 28 weeks, and the baby is premature, maybe in the nursery. So you see how a small thing can lead to a big thing. So if this woman, the same woman, she has come to the doctor, she has changed her medications, her blood pressure is checked, medication has been given to her, and her blood pressure is controlled, and then the safe medication is given to her, which is good for her as well as for the baby. And during the pregnancy, if she comes for the antenatal care, the outcome would be good. Similarly, the people who are having some operation on the uterus, they become immediately pregnant. In the last couple of weeks, we have an operation which came early morning, and the patient presented as a severe pain in the tummy. She was referred from some private clinic. I got a call. I was on call on that day. It was a weekend time that we have a woman. She is having a severe abdominal pain and she has a diarrhea. And they were thinking that the woman is having a diarrhea and the blood pressure is down. I asked them that what is the situation in her past, her history. They said the woman is 7 months pregnant and she has a septum resection of the uterus because of her infertility. Septum is a small part in the uterus which was cut, and it was the cause that she was not able to get the pregnancy. And within 3 or 4 months, she got pregnant. That part of the uterus was weak. Actually, she should use the contraceptions for 2 years, and later on, she should be pregnant because this area of the weak scar needs a time for the healing. So, what happened? This area could not bear the weight of the baby, and the uterus ruptured. As a result of which, she was bleeding inside her tummy. Then I told her blood pressure. They said 80/50, and the pulse is 120. I said immediately shift her to our hospital. We opened her up, and the uterus was all ruptured. Baby was dead. So you see, this is how the things come, and this is how we are also affected as a doctor. So this is all these stories. They just urged me to start this journey of safe motherhood initiative. Then the importance of the pre-pregnancy care. Why is it important? The pre-pregnancy care can significantly reduce the risk of complications during the pregnancy because it identifies any pre-existing health condition which may be addressed, which may be managed prior to having the pregnancy. Investing time in the pre-pregnancy care can lead to a healthier pregnancies and healthy babies. So in the medical history, what is important? In the medical history, a doctor can ask the woman about her medical problems to identify any risks, pre-existing conditions like the high blood pressure, high sugar levels, diabetes, or autoimmune disorders like the rheumatoid arthritis, systemic lupus erythematosus. They need a special attention and special medications which are safe in the pregnancy for the baby and for the mom. Family medical history can also provide insight into the genetic condition which may affect the pregnancy because sometimes the people are having the abnormal babies which are born in the family. So here lies an importance of having the family history of any abnormalities. Then comes the vaccination and immunization. Ensuring the vaccinations are up to date, and specifically measles, mumps, and rubella. These are those vaccinations which we do not give during the pregnancy because they can affect the baby. If a woman she gets the rubella in the pregnancy, there can be many complications to the woman. So it is very important to make sure that she is immunized. And in 90% of the time, we all get these vaccination in our childhood. Then becomes the tetanus, diphtheria, and the pertussis. Although the tetanus can be given during the pregnancy, it's better to complete all of these things before you become pregnant. It is advisable to discuss any necessary vaccination with the healthcare provider prior to conception. So these are the important things which you should discuss with your doctor. Then comes the nutritional assessment. Nutrition plays a vital role in the fetal development and the maternal health. Women should aim for a balanced diet which is rich in vitamins, minerals, irons, and good nutrients. And make sure that you take a proper amount of the folic acid. Over here, I would stress that I have seen in my clinic that the doctors are giving 5 milligram folic acid to everybody. 5 milligram folic acid is not required for everyone. This is required for high risk pregnancies. For example, those women who are obese, those women who have epilepsy attacks, those women who have the previous history of abnormal babies, there they need more folic acid. Otherwise, 1 milligram folic acid is enough. So this is very important to discuss about the folic acid supplementation. Then you have to improve your daily routine. You have to take care of your well-being, not only in a weekly basis, monthly basis, no, on the daily basis. You have to make yourself happy, and you have to be stress-free on day-to-day basis. Adopt a healthy lifestyle which can significantly enhance your fertility and the pregnancy outcome. Women are encouraged to quit smoking, alcohol intake, and avoid the recreational drugs. Regular activity can also prepare you for the pregnancy and your body to be in a healthy state. So these are the important things. And weight management is again very, very important because the women who are having the more weight, they are at increased risk of developing the high blood pressure, diabetes, and also the preterm babies, abortions. These are all the complications which can happen in the high weight women. And also the women who are obese, even for them, the birth is very difficult because their uterus is full of the fat. It cannot contract. And if they deliver, then there is a chances that the shoulders of the baby may stuck up. And there are the chances, God forbidden, that the baby can die even during the process of birth. So you see, if the weight is not properly managed, it can end up in a lot of the complications. So don't think that eating too much and then having a lot of the weight will not affect the pregnancy. Obesity itself can be a big challenge for the woman and for the obstetrician as well. Even the cesareans for this woman is very difficult. Two or three doctors, we have to struggle hard to do the cesareans. It is too difficult to manage the big tummy as well as to take the baby out. And then even after that, the postpartum recovery after the cesarean is very difficult for such a woman. Their stitches are at risk, wound may become infected. So a lot of the things can happen. The clots can happen in the legs. So these are all the things which can go wrong if the weight is not properly managed. So I would say that please be sure you have a healthy weight before you enter in the pregnancy. Then, about the mental health consideration. Mental health is an integral part of the pre pregnancy care, which should never be ignored. Stress management techniques and the mental health supports can improve the overall well being of the woman. Addressing any mental health concern prior to the pregnancy can lead to better outcome. So, this is also very important. Planning and the timing. You should know about the fertility period, which we can discuss sometime other in some other lecture, how you calculate your fertility period. Couples should discuss their readiness for parenting and any potential challenges, right? Then the follow-up care. Follow-up care is ongoing communication with the healthcare providers is essential during the pre-pregnancy care. It doesn't mean that okay, you are planning a pregnancy, fine, you went to the doctor for the pre-pregnancy care, and the doctor told you that these are your options. You have to take these medications. You have to do the contraception. This is not only the way. No, you have to go back and ask the doctor after 1 month or 2 months, for whatever time she has given to you, that you have to go back and ask her, am I fit to have the pregnancy now? This is in order to avoid any upcoming problems and to have every mother happy. So the follow-up care is as important as your first visit with the doctor. So ongoing communication with the healthcare provider is essential during the pre-pregnancy phase. I have written the word ongoing communication, which means that you have to go back, you have to discuss, you have to communicate. Then regular checkups can help monitor the health and address any emerging concern. If you feel any difficulty, for example, your medications are changed, you are facing any difficulty in reduction of the weight or any problem, you can also discuss it at that time. And very important, which I do with all my patients, about the birth planning. Birth planning usually I make beforehand when the woman is coming in the pre-pregnancy time, or usually at the 36 weeks of the pregnancy. I always ask her that what is a birth plan? What do you think? How would you like to deliver? What are your options? What is safe for you? And what will you do in the birth? I think we will also have another webinar about the birth planning, because this is a very neglected area, which I think woman has the right to know about what are her options. She can go for normal vaginal birth or she has to go for cesarean. If she has to go for cesarean, then on what basis? Because we want to reduce the cesarean section rate as well. This is not like everybody comes and have the cesarean. There is a chance for after one cesarean that the woman, even after two cesarean, the woman can deliver vaginally. But you have to see what is safe, up till what time we can go ahead. And if she goes for that plan, what are her options, how it will be, where the birth will be, what can happen, and what will be the backup plan. For example, this is I'm discussing about a woman who has a previous cesarean section. Now she's planning to have a normal birth in those cases. So birth plan, who will be with her during the birthing process, her husband, whatever she wants during the birthing, which position she wants to have during the birth, who will cut the cord. These are all the things which they have to be taken into account before the pregnancy, in the pre-pregnancy time, or during the pregnancy. Usually I discuss it in between 36 weeks to 39 weeks gestation onwards. And if the woman, she is having a previous section, now she's keen to have a vaginal birth, I start discussing it from 30 weeks onwards, so that she has the time. I give them the information leaflets, I tell them read and then come back to me in the next session, then so that we can get time to know about the things and we can answer your concerns. This is how the birth plans are made. And we will have a presentation on the birth plan next time. So with this, I will end up my session, and this will be a time for the question and answer. We can address all of your questions and the queries you can ask in the chat box. And uh, then so after this, I would say that you can get a face-to-face consultation with me. If you have any question or anything, there is a free face-to-face consultation with me. How you can request this face-to-face consultation in order to maintain your privacy as well as confidentiality, because all of you, I respect all of you. I respect your confidentiality, and I want to keep everything as a confidential. So what you need to do, you have to go to our WhatsApp, which is the RD Women Hub, and you can send a message in the group with the following details. You can type the message, I need a consultation. You have to write your full name, your email address, your WhatsApp phone number. Our team will share the meeting link with you to connect you with me on the consultation day, because I'm planning to have one day as a free consultation for the people, in which we will just discuss about their free consultation one by one in as a free session. And regarding few things about the RD Women Hub, kindly make sure that please put your names when you are sending a request to join the RD Women Hub, because this is a highly specialized, and this is a very confidential group which only deals with the women. So please, no men are allowed to join this, because we are related with the women, and the woman has got a lot of the things, and many a times the women don't come out with their problems. They are feeling shy. For that, I want them to come forward and discuss their things. This is very important. Anyone who is sending me a request without name, I'm sorry, or with the icon, just icon without any name, I cannot allow you to join this group. I want to know who is she with the name, number one. And number two, this is for your confidentiality and for your colleagues and your other members' confidentiality. This is very important, number one. And number two, you cannot post any ads on this group, because this is highly for the education of the women. This is not meant to do advertisement of any sort. I'm really sorry for that. I hope so you will be understanding my point. And thirdly, the chat box is usually for the admin related. However, on every Saturday, I will open it up for a few hours, because of my very busy schedules. I cannot do it on the daily basis. However, I will try my best to answer your queries and the questions there. For that time, when it is opened up, kindly share your queries and the question, and I will try my best to answer your questions. And regarding those women who want to have a consultation with me, you can always contact us on the given link, and you can always have a consultation with me. And the other, we are available over there 24/7. And also, I would like to say that if you have any problem, anything, please come forward. And we have to go hand in hand. You are all a part of this team of Safe Motherhood Initiative. I'm not the only one. You have to be my team. I want everybody to be a part of my team. I want to save mothers at whatever level we can go. So, for that purpose, I have made many videos about like sickle cell disease in pregnancy, epilepsy in the pregnancy, high blood pressure in the pregnancy, gestational diabetes in the pregnancy. You can all go to my Instagram or Facebook account, and you can all see and watch all of these videos. And please share it with your other people, other friends, so that they can get the benefit. As I said, that there are three delays in the problems of the woman. Decision making delay, this is the first D. Then D is a transportation, and then D is a delay in the treatment in the hospital. So we want to reduce these three delays. And as we know that the pregnancy happens with the young woman's body is able to cope with the ongoing problem. We have to struggle hard in that golden time in order to save her life. I hope so. My message is there. And Isa, I can take the questions now. And on the other thing, please write down your questions and also your feedback, please. That how was the session? What are the topics you would like to have?
Okay, great. So the first question is by Noor, and she's asking, what are the best ways to prepare my body for pregnancy?
Yeah. Noor, this is a very good question. Just give me 1 second. I'm coming back to you. Yeah. So, Noor, actually, I said that you need not only a physical fitness, but your mental fitness as well. So you have to work on both these ways. And I said that you have to prepare yourself by the physical means as well as by the mental well-beings. And in the physical fitness, you have to go and consult your doctor and to know if you have any problem, you have to discuss about it. And from the mental well-being, you have to be relaxed, you have to manage your weight, you have to manage your nutrition. As I said in all my first part of this lecture, so these are the actual things which you have to take into account.
Okay, great. The next question is from Alia, and she's asking, when should I consult a doctor about fertility concerns?
Yeah, actually, nowadays polycystic ovaries, irregular periods, and the lack of ovulation, lack of the egg formation is the most important cause of the infertility. And infertility is actually when to seek advice. This is a very good question, I would say that. And if a couple is who are living together and who are not using any contraception, they are not able to conceive for 1 year, then they should consult for the doctors. This is for the routine, healthy young couple, number one. However, if the woman, for example, she's 39, she's 40 years, here, if you do not have the conception within about 6 months, then you can start thinking about it because we don't want you to lose more time, right? So this is the way. Or the third thing is that at any point, if you anything is bothering you, go back to your doctor and discuss it with her. Nowadays there is online consultations, online doctors are available, you can do it from the comfort of your home. And our RoyalDocline is also offering the online consultations. You can get the consultation from me as well. This is up to you.
Okay, so the next question is, what are the very, very early signs of pregnancy that I should watch for?
Yeah, very nice question. uh, Pregnancy has got number one, period stop, number one sign. Number two, you can have the nausea and the vomiting of the pregnancy, feeling tiredness, feeling sleepiness. These are the usual things. Most likely, the period stop, number one, and number two, the vomiting. These are the two important things which comes first. So you can watch these things, but nowadays there are the kits available which can even detect if you do not miss your period. People are doing that even. You can put that stick into the urine and it can tell you you are pregnant or not. And even if the woman has not missed her period, maybe even 1 or 2 days before that. So this is the way the things are going on in this era.
So the next question is, how important is my partner's health in pregnancy planning?
Very important because the partner should also be, again, both physical and the mentally healthy. The men who are smokers, who are alcohol users, who are obese, they are more at the chance of getting the low quality and the quantity of the semen and the sperms. And their chances of getting the pregnancy becomes lower. So we do not only stress upon the women health, we also stress upon the men health regarding the pregnancy and the conception. So this is very important. And secondly, the stress level. The stress should also be reduced because in the stress in the body, when a woman or a man is stressed out, then the hormones, which are the corticosteroids or the steroids or the adrenaline, they come into the circulation. So they decrease those hormones which are fertility friendly, as a result of which the amount of the eggs as well as the sperms and their quality decreases, so that they have to be careful about it. So please remember, not only the woman, her partner health is also very important.
Okay, so the next question is, can I travel while trying to conceive or during early pregnancy?
It depends upon that how is your pregnancy, how is your body, and what is your previous history. For example, if a woman comes to me, She does not have any risk factor. Previously, she has given birth to normal children. There was no history of the birth before time. She is not hypertensive. She is not bleeding at the moment in the pregnancy. She is not having any medical disorder. She is not having high blood pressure. She can travel. There is no problem. However, if a woman comes to me, she is bleeding in this pregnancy, she is having a medical disorder, she is on medications, and for example, she is hypertensive, her blood pressure is not very well controlled. So I will not allow that woman to travel. So we cannot say that one size fits all. Everybody is different, you know. So everybody has to discuss their things on the individual basis with their doctors.
Okay, so the next question is anonymous, and our participant is asking how long to wait before a second pregnancy. And thank you very much, Dr. Yasmeen. Your session is being appreciated a lot.
Thank you very much. I'm so happy to have you all over here. And we are discussing, this was my dream to discuss the things live with the people and to tell them that how they can make their life, their journey through the pregnancy very safe. So, coming back to the question, the time interval between the first pregnancy and the second pregnancy, it is variable. Actually, at least 2 to 3 years should be given for all the women, specifically for those women who are delivering by cesarean section. Okay. Why? Because your uterus has a scar. We open the uterus when we take the baby out. We incise it with the help of knife. We open it up and then we take the baby out. So this is same as you get an incision on your skin. It is a weak area. If the woman will become very quickly pregnant, there is a chance that she can have a rupture of this scar. Scar may open up. Okay. So as I said that we have a patient and she had a pregnancy and the uterus was opened up at 29 weeks and the baby was dead. Baby was in the tummy. All the uterus was opened up and there was a bleeding like anything. We gave her 14 units of the blood. We admitted her to the ICU. I made a video on it. Even this is available on Instagram. I was so depressed on that day that how the things are ongoing. So I decided to make video. When I came out of the theater, I decided to make a video. I made it and I posted it on the Instagram so that the people can get the information, how the things go on if they ignore their body. And sadly, she was an educated lady. Then later on, we spoke to her. So coming back to your question, so number one, if she has got a previous cesarean. Number two, you need time to spend with your child. Let this small baby to have a little bit stepping up so that this baby becomes independent and can manage the things. This is number two. And number three, if you have got iron deficiency, you have the high blood pressure, you have diabetes, let it to be settled down in that time. So for me, I would say that at least 2 to 3 years gap is very important for each and every woman so that her body heals, baby gets time for the breastfeeding, baby gets time for the proper care by the mother, family gets time, family bonding happens, and then she should go with the second pregnancy in a proper way with the proper mental and the physical well-being.
Okay, great. So next we have a small feedback from Mariam. She's saying that this webinar was very beneficial and she's looking forward to another webinar around the topic of delivery. And then we have a question. It's an anonymous question, very interesting. Can I take fat loss or appetite controlling supplements in pregnancy?
We don't allow these fat losing or the supplements during the pregnancy because all of these things, still the studies are not 100% sure that what they do to your body. And they are not allowed, specifically the plant based. Although they are saying it is safe and this and that, but as an obstetrician, I have seen that the women can have caused the problem to their children because you don't know what they are adding in it. And this small baby can suffer. There can be a damage to the heart, there can be a damage to the brain, there can be damage to the limbs. So please don't take these supplements, don't try these medications during the pregnancy. Rather, I do not agree for my patient even to take one paracetamol during their pregnancy until or unless it is really needed. Then I tell them, okay, you go ahead and take it. Even for vomiting, I tell them you have to do some lifestyle modifications. I give them the medication once it is really needed. Otherwise, I always tell them avoid them.
Okay, please guys, do not take any fat loss supplements. Don't worry about your weight. Like you can lose your weight after the pregnancy. Don't worry about it at all.
And
Okay, so
here lies the pre-pregnancy planning.
yeah, yes, very important. And that is why you should always consult your doctor even before you start your pregnancy and even before you start thinking about having a child. It's very important to know all of these things because there are a lot of myths, in our society circulating around these things, which are very, very, can be very harmful for you in the long run as well. Okay.
Yes,
So
true.
moving on to the next question. Okay. So what are the risks of getting pregnant after 35?
This question I usually get in my clinic as well. I made a video about it on. It's available on the Instagram. You can go there. You can see that the age and the fertility. Fertility decreases, number one. Number two, if you become pregnant after 35 years of age, there are the chances the woman can get high blood pressure, woman can get diabetes. These are the two major things which can be there. And then also another thing, baby can be affected. The Down's syndrome or the chances of the abnormal pregnancy increases. When I teach my students and I teach my patients, what I tell them, whenever you go to watch a movie, what you do, you take the popcorns. When you eat the popcorns, what happens is that on the upper surface, you have very nice colored, nice textured, nice taste popcorns. And when you finish them up during your movie, when you go down and down, then you see the blackish, rotten, and the taste is not good. Those popcorns are left behind. Same is with the ovaries or your egg producing organs. When the woman is young, the eggs are of the good quality, they are nice, healthy babies. But as you go older, the chances of having the chromosomal abnormalities, abnormal children, Down's syndrome, they increases later on. So I would say that that's what I said. Okay, the woman should be career oriented. I don't have any objection. But if you are family oriented as well, and you are planning to have the pregnancy, so you should do it in between 20 to 30 years of the age group. Although women are also becoming pregnant at 40 years, 42, 43. When they come to the clinic, I ask them that what is your next plan? You have the 5 children before. She says, doctor, my sister, she is producing at 45. Another one of my friends, she produced as 50. Okay, but you never know who is the one who can get the problem. So if you want to plan your pregnancy, better before 35 years of age group. However, the people who are planning their pregnancy 35, they should consider that these are all the risks which can happen.
Okay, great. So Muzna is asking how long should I wait to get pregnant after stopping birth control?
Yeah, actually, after stopping the birth control, you can immediately become pregnant. There is no harm after stopping the birth control because these birth control pills, they have estrogen and progesterone, which is not causing any harm to the baby. They are the same hormones which will also come in your body, but they are given to you from outside in order to lower or not producing the eggs. So once you stop it, immediately you can get pregnant because you will take little time for your eggs to come back once you stop the pills. So there is no harm in becoming pregnant immediately or whenever it is. It's okay.
Okay, so I would like to add that this is a very common myth that I see, especially in circles in Pakistan. Birth control is such a taboo, and people think that if you take birth control, it can affect your pregnancy and your fertility in a really, really negative way. But in reality, that's not the case. Right, Dr. Yasmin?
Yes, over here I will just add a little bit point. You are right, Dr. Iza. But birth control pills in 1 out of the 100 women, they can give rise to post-pill amenorrhea. That is, they stop their periods at all. But this is only 1 out of 100. So 99 will not have. Birth control pills are very safe. However, you should use them with the prescription, not by yourself, because they are not for someone with the cardiac disease, heart disease, not someone with high blood pressure. So you have to discuss it with your doctor, right? This is very important.
Okay. So another question with regards to this same topic is, can certain medications impact my chances of getting pregnant?
Yeah, there are certain medications which can affect your chances of becoming pregnant. For example, if the woman she is taking some antihypertensive medications which are not safe for you or for your baby, so you have to switch back. This is here lies the pre-pregnancy care and the planning. So you have to discuss it. There are the certain medications which can be abort efficient. You may not be able to pregnant. There are certain medications which can suppress your ovulation, where the eggs do not come out. So these are the things which you have to consider. So always discuss it with your doctor before you become pregnant and before you are planning to become pregnant. For example, if a woman she is using some medication, uh, God forbidden, somebody is having a breast cancer. Just take that example, and she is on some medications or some chemotherapy. If she becomes pregnant, then first of all, it is very difficult for her to become pregnant. Number one. Number two, if by chance she becomes pregnant, there are the chances having the methotrexate, having these things, anti-cancer medications can give rise to a lot of the complications in the children, in which the brain defects, heart defects, kidney defects are very common. So God forbidden, in some of the cases, we have to go and we have to terminate this pregnancy. Similarly, the retinoids or the anti-acne cream, which is very much in use nowadays, retinoic acid, these are the medications. Please make sure if you are using it, you should not be pregnant at least 6 months to stop your medication. You have to stop this medication 6 months before you attempt the pregnancy, because these medications are associated with a lot of the complications in the children. And if the woman, one time we had one case, she came, it was a first pregnancy, 6 weeks, fetal heart was there, and the patient was using the retinoic acid, and she came for the termination. So, as we discussed with her, she was on the medication when she became pregnant. And there are the high chances the woman can get the deafness of the child, the ears or the hearing capability. The child may be blind. There can be the brain abnormalities, heart abnormalities. So she was offered the termination, and it was very difficult decision. And here, the two consultants they take a decision. They have to sign a special form, and the woman has to sign a special form. And it is very difficult to stop the heart and to do the termination of this pregnancy. So please be sure that what you are having and what you should stop before the pregnancy, what you should switch over during the before you become pregnant and during the pregnancy. So here lies the Safe Motherhood Initiative.
Okay, great. So the next two questions, the one is about the ovulation cycle, how to track it really effectively and really accurately. And the next question, which is related to it, is how does family medical history impact my pregnancy journey?
I will come back to first question first. Uh, I have made a video about it, that the fertility tracing and the ovulatory period, how can you detect that? There are the many things. This video is soon upcoming into on Instagram, so be watchful on that. You can get it there. There are few things. Number one, your basal body temperature increases. Your temperature usually increases a little bit. You will feel little bit pain lower down. And number three, the vaginal discharge. It becomes more slippery and more, thread like. This is these things. And if you want to have more accurate, then you have to do the LH kits. LH kits are available outside in the market. And every day when you finish your period, usually this is from 12th day till the 14th day, 16th day, where on any day the ova can come out. Why? Because the ovum comes at about 12 plus minus 2 days actually. Every woman is different. Usually the cycle is 28 days. And if the woman ovulates at 12th day, she can have it, or she can have it on 13th day, she can have it on the 14th day. So these are the ways. How to calculate this 12th day? This is also again very important. The first day of your period is the first day. From there, you will calculate. For example, your first day is 5th of September. So 5th, 6th, 7th, 8th, 9th, 10th, 11th, 12th, 13th, 14th, 15th, and 16 is your 12th day. So 12, 13, 14, 15, and 16. So this is the 1 week where the ovulation can comes. The physiology of this is the egg is alive for 24 hours and the sperm is alive from the male for 72 hours. So the egg, if it is alive for 24 hours, it has to be fertilized during that time. So these are the physical symptoms, as I told you, that is the temperature, pain lower abdomen, and the slippery discharge from the vagina. These are the physical symptoms. And the biochemically, you can detect it with the help of the LH kits. When the progesterone is coming into the circulation, and in the urine, if you dip it, this is just like the 2 lines as you do the pregnancy test. So this is more confirmatory. So you can avail that. This is how you do that test. The second question was regarding the family history. The family history is very important in the different aspects. Number one, if the woman's mother or the sisters, there is a delay in the conception, there is more chances that this woman will also be at the risk of having a delay in the conception, delay in the pregnancy, a delay in getting the pregnancy. Number one, if there is a family history of certain chromosomal abnormalities, she is at the risk of having those chromosomal abnormalities because all the genes they pass through the steps into the generations. They may sometimes skip or sometimes they go. For example, the sickle cell disease, it passes through the genes. Similarly, if the woman she has a high risk of having high blood pressure in her mother. So this woman, she herself will have a high chances of the high blood pressure during the pregnancy. That's why we always ask. And at the same time, if there is a family history of the twins in the family, so this woman is also having a chance to get the family, to get the twins in this pregnancy. So this is how the family history affects the pregnancy journey in a woman.
Okay, so the last question is about, like, it's threefold. They are asking about the vitamins and the supplements and the vaccinations, which are very important to take before pregnancy and during it.
As I said in my presentation, we will go one by one. We will talk about the vaccination. The vaccination, measles, mumps, and rubella, you have to complete them beforehand. Many times when the woman come, I do the rubella test to check whether she's rubella immune or not. 90% of the time, they are immune to rubella. Rubella is a germ measles. And in rubella, if the woman is affected with the rubella virus, the child may be affected. There can be blindness, there can be the deafness, there can be heart problems. And this vaccination is not safe during the pregnancy. If I do this test, I do the ultrasound, everything is good. She is rubella non-immune, I will not do anything. But I will advise this woman after the birth of baby to take rubella vaccination, have the contraception purely at least for 3 months because sometimes the people they don't take the contraception, they take the vaccine, go home and then become pregnant. No, I make sure that she at least practice this contraception for 3 months so that she does not become pregnant after this vaccination at least for 3 months. This is very important thing. Secondly, the tetanus. This tetanus vaccination, it can be taken during the pregnancy. Similarly, nowadays there was a coronavirus vaccine. Coronavirus vaccine, there is a lot of the research about it. I made a video about it and this is also coming on our website again very shortly. So she can take this vaccination during the pregnancy. She can take the tetanus vaccination during the pregnancy. She can take hepatitis A virus vaccination, hepatitis B virus vaccination during the pregnancy. So these are those which can be taken. But there are certain viruses which she should not take the vaccine during the pregnancy. That is before the pregnancy. This is the answer to your first question. Secondly, regarding the multivitamins as well as the nutritional supplements. Multivitamins, you can take vitamin B12, vitamin D even before the pregnancy, and even you can continue during the pregnancy. And they help in getting the pregnancy as well. But the most important vitamin is the folic acid, which we want you to take even before the onset of pregnancy, as well as during the first 3 months of the pregnancy. And there are certain women where we have to give them for whole of their pregnancy. For example, if the woman is epileptic, and she is taking anti-epilepsy medications, so there she may be deficient in the folic acid where we have to give it. So as I said that in the pregnancy, no one size fits everybody. Everybody's different, but this is a general overview which I'm giving to you.
Okay, great. So I'm sorry, there is also going to be one last question. Muzna is asking, how do I know the best time to conceive?
Yeah, as I said that if when once you are mentally and physically okay, then you can have the pregnancy. And mentally, you are the best judge. When you think that you are okay, you can get pregnancy. This is up to you, your mental state of the health. When you are happy to get pregnancy. And secondly, regarding the physical, this one I will say that please make yourself clear from the doctor that you are okay and you can have the pregnancy. If you are not having high blood pressure, you are not diabetic, you do not have any problem, fine, you can go ahead and have the pregnancy. However, if you have high blood pressure, if you have heart disease, if you are having any medications, you are suffering with something where having the pregnancy can affect you, I would say that please don't be pregnant for this much time. You have to take this medication. You have to control your everything. You have to control your thyroid. You have to control your sugar levels. Then I will say that become pregnant. For example, the woman comes to us and she is diabetic. She becomes pregnant. She doesn't know. She is on insulin. Now she comes and her sugar level is very badly controlled. She is 8 weeks or 9 weeks, and this is the most wanted pregnancy. But we know she will abort because when the high blood sugar levels are there in the body, the brain, heart, and the kidneys of the baby cannot be formed properly and up to the mark normally. So this is how the things happen in biochemical way. So I would say that you have to see your mental health by yourself, and for the physical health, if you have any problem, you have to consult. Rather, I would say that every woman who is planning a pregnancy, even if she is normal, she herself is thinking she is normal, at least one time she should go to the doctor and ask that, am I fit to get pregnant? She will check your blood pressure, she will check your pulse, she will take the history, she will examine you, maybe she will ask for a few tests. And if you are okay from all the sides, then we can give you a green signal to go ahead.
Okay, great. So guys, as you know, if you want to ask any questions one to one with Dr. Yasmeen alone, we have the link to the WhatsApp group pinned in the chat. You can see it. We have already shared it with you. Um, the group's name is RD Woman Hub, and RD stands for our brand, of course, RoyalDocline. We also have shared all the links for our website, for our email, for our Facebook, Instagram, TikTok, and LinkedIn. So if you are interested in watching any of the videos that Dr. Yasmeen has mentioned, or if you want to request specifically for her to make some videos, she can do that as well. And you can contact us on any of these links if you want, whether you have a question or you want to book an appointment. And I would love it. We would all appreciate it if you guys can share your feedback. That is very important for us. And we take your feedback very, very seriously, and we use it to plan our webinars, we use it to plan our health blogs, and we use it to plan our videos as well. So as participants, you guys are extremely important to us. Your feedback is extremely valuable. Please remember that. I'm not just saying it for the sake of it, and we actually do take it into account.
As the
And
while the people
yeah.
are yes, please go on.
Okay. So okay, so we do have one last question. I'm sorry, Dr. Yasmin, there is a lot of interest in this webinar. I'm going to ask this last question and then we have to go. So the question is, what foods should I avoid when planning to get pregnant?
This is what actually is I interrupted you. I saw this question. This was popped out right now in the chat. I saw that what foods the I am also very much enjoying this session personally, and I'm feeling that my vision of having the Safe Motherhood initiative is now on the way. So, regarding the foods, you should avoid spicy. and foods which are high in the preservatives, and like the canned foods or spicy foods, which are enriched in lot of the salts, and very much fried foods, and the junk food which we eat very eagerly from outside. You should avoid those. Keep the things simple. Hydrate yourself. Take good food, simple food, vegetables, fruits. Make your life easy. Avoid lots of the meat. Avoid lots of the chicken. So be more towards the normal food. And believe me, you will feel the difference.
Okay, great. So
So
I'm
there is a
going to
popped out that I feel more confident about planning a pregnancy.
pregnancy. Yeah. And Laiba is
Mhm.
saying that this was a fantastic session on pregnancy planning. And Ifat also is expressing that the webinar gave her a lot of helpful information about pregnancy planning. We are very, very glad that you guys are liking this. And again, if you have any questions, you have all of our links. And even if you forget or anything, just reach out to us. You can even email us, you can text us, you can call us, you can message us on WhatsApp, whatever feels comfortable for you and whatever is accessible for you. All you need is just an internet connection, and that's basically it. Over to you, Dr. Yasmin. Do you want to say any closing remarks?
Yeah. I would say my heartful thank you to all my loving and all beautiful ladies for joining me today, for making this webinar possible. My special thanks to Dr. Iza, who is the backbone of this webinar, who was urging me to arrange this webinar. And I'm feeling myself as a fulfilled that I have done my responsibility. You know, as a doctor, there are a lot of the responsibilities, not just to earn money. No, there is a responsibility to save the patients. When we see the complicated things, we see the complicated pregnancies, I really tell you, we also become stressed out. And when we see the woman having the fitting, fits, high blood pressure, and you are nowhere, what to do for this woman? You have to tell the woman, you have to tell the family. So you are all part of my team of this journey, Safe Motherhood Initiative. And my brand name is RoyalDocline. This is not a one person effort. There is a marketing team for me, over all the team members. I'm very thankful to you to make this webinar possible. My family members as well, who gave me this time to speak to all of you. And for you people, we have created the Royal Docline Women Hub. As I said in my slides, this is specifically only for the women because I want the women to speak about, to keep it confidential. I don't want any male to join and to have any information about my patients, my beloved members of this group, number one. And you feel lot of the confident that you can open up, you can discuss anything, whatever you want. And secondly, as I said that I appreciate your questions, but due to my responsibilities in lot of the things in my operations, in my on calls, in my clinic, in my teaching sessions to my and as an examiner, so it is not always possible to answer all the questions at a time. So that's why we have blocked it. Only the admin can post their post. This is for this reason. Please don't feel it. My apology for that. But I would request all of you, there will be a limited time, usually on the weekends. I will open it up. I will ask my team to open it up for a while. You can put your questions and please wait. Your turn will come. I will try to answer one by one. And in the meantime, there is another way to contact me. One, we are doing a one-to-one session. My team member, he's very enthusiastic member, and he said we can do a free face-to-face consultation for the people in our upcoming webinar. This is one. This will be solely for this purpose, that you can ask in a separate room as a confidential, because your confidentiality matters a lot to me as well as for my team. Nobody else can listen to you, and nobody can else listen to me when I'm giving the consultation to you. There will be a link for that purpose. and you can send us that your name and your phone number as well as your email address, and just write in the text, I need consultation. So I will include your name, and you will be sent a link where you can join and we can have a free consultation in that way. And the third way is that you can keep watching my upcoming videos on the Facebook, on the Instagram, on the LinkedIn, where you can have a lot of the information. You can share it with the other women. This is your responsibility now to be with me in this journey of saving the mothers, saving the women. And the other part is that you can book your own consultation with little bit amount of the money, which is not very high. This is only for uh, the team members who are making all these things possible. You can even do that. Everybody can afford it. And in the meanwhile, you can track on my Instagram page and all the other pages. You can get the information from there. And please feel free if you want to have any special webinars, we will arrange that. I'm planning to have high risk pregnancy next time, and another one about the birth plan. So these are the things which I'm planning to do with you people. And I'm really very thankful for your time, for the efforts. And we have to go by joining our hands to save our mothers, to save the women. Because recently I saw a very young woman. She developed a cancer of the uterus without a proper diagnosis. She was single, unmarried, and she was stage 4. I really become very upset on that day. Then I decided to make a video about the endometrium cancer, and this is in the way I'm making as I see day-to-day basis. I'm taking those into account. Whenever I get time, I make the videos, I post it. It is in order to create awareness among the community. So you have to be my team.
Thank you so much, Dr. Yasmeen, especially for your time, because you take your time out from such a busy schedule. I understand that you have a really, really hard routine and everything. And everybody who is listening to us, I would urge you guys to take advantage of this offer. Like, there is, it never really happens that a doctor is asking you, a doctor who's at this level of expertise is asking you to come forward and ask your questions freely and anonymously in the groups as well. And thank you so much for your feedback. We are getting a lot of feedback. And thank you so much to everyone who are telling us that they are going to share this webinar as well. That would do a lot of good for a lot of us, everyone around us. And thank you so much for everyone for joining. Remember, the links are in the chats. Remember that. Please copy and paste them, or you can even message me personally if you need them separately. I will answer to you immediately. And we will see you inshallah next time. Thank you so much, everyone who has joined, who has taken their time out of their weekends, essentially. And again, thank you so much, Dr. Yasmeen. It was very, very informative, very enlightening, and we will see you inshallah next time.
Thank you so much, Dr. Isa, all the members who joined. Stay blessed. And I have requested my team to record this session so that the people who are unable to join because of the time, because of their responsibilities, so that they can get it and they can get the benefit of it. We have to work, remember, for the Safe Motherhood Initiative and the Women Health. Please remember, these are my last words. Goodbye.
Thank you so much. Goodbye. Goodbye, everyone.